Let's first start off with the fact that we had the unique opportunity to really study what's going on within the tumor using neoadjuvant checkpoint inhibitors, in our case pembrolizumab, in MMRd endometrial cancer. Because it is neoadjuvant, we therefore, after 2 courses of pembrolizumab, because that was the amount of courses we have given to the patients, we then perform full surgery on those patients, so removing the uterus and the lymph nodes. And not only that, also during the neoadjuvant course of treatment, within the disease of endometrial cancer, you have the unique opportunity to get tissue from the endometrial tumor by biopsies via the cervix. So we had great material for those wonderful patients who were willing to enter this study to really look into the aspects which were changing upon treatment with neoadjuvant pembrolizumab. And within that, we got to the observation that there was a difference in the antibodies produced by the B cells compared to those who had no neoadjuvant treatment upon doing surgery. And that will be the main part of my talk, skewing the B cell response in a sense that, normally spoken, you have good amounts of IgA and IgG. But the moment you come in with neoadjuvant checkpoint inhibitor, almost no IgA anymore, and an increase of your IgG.